Hello, I'm Dr. Manuel Saldivar. I'm a cognitive psychologist and a university faculty member. This short video is meant to provide students who have an interest in working in an applied psychology field or related field an overview of career paths in mental and behavioral health. Many students who come into college, especially those who choose to major in psychology, often have an interest in working in a therapeutic or counseling role, but at the same time, those same students often are not aware of all the various paths that exist within this space. So I'd like to briefly describe some of the different pathways that you can choose to pursue if you'd like to work in mental and behavioral health. The best known role, typically, best known because of media representations in movies and TV shows, are psychiatrists. Psychiatrists are mental health professionals who are trained as medical doctors first. So that means that they have to go to college. In many cases, may earn a master's degree as well, and then earn a doctorate, an MD or a DO, a doctor of osteopathic medicine. So as medical doctors, they have additional training after finishing medical school, allowing them to specialize in the treatment of severe cases of mental illness. As medical doctors, licensed by the particular state where they are practicing, they're able to provide therapy as well as prescribe medication if appropriate for a particular case. Psychiatrists can be found in many settings in the healthcare world, from government agencies, the military, public and private hospitals, clinics, and of course their own private practices. A lesser known pathway, also within the medical field though, is a psychiatric or mental health nurse practitioner. These individuals are trained as nurses at the bachelor's level, so they are RNs first, but then they will earn an advanced degree, a master's, or in some cases a doctorate. With this advanced training, they're able to assess, diagnose, and treat various mental health conditions. They are able to provide therapy. They can also prescribe medication if necessary, working under the supervision of a medical doctor. Like psychiatrists, psychiatric and mental health nurse practitioners can be found in various healthcare settings. Clinical psychologists are a particular role that, again, many psychology majors in particular often have an awareness of or even aspire to working as clinical psychologists. Uh, Clinical psychologists will typically hold a doctorate, either a PhD or a PsyD, which is an alternative doctoral pathway. In either case, from the standpoint of providing therapeutic and counseling services, the end results are the same. Clinical psychologists are able to provide evaluations, diagnose individuals that may have mental health, behavioral health issues, and provide therapy to assist those individuals with the challenges they face. Because clinical psychologists are not medical doctors, they cannot prescribe medication. As of the creation of this video, 2024, in the United States, I'm aware of only one state, California, where under very limited circumstances with special training and additional licensing, California does allow clinical psychologists under some circumstances to prescribe medication, but that is the only state in the U.S., again, as of 2024, where that is the case. In every other state, clinical psychologists are not able to provide medication. Social workers are often a role or pathway that many students are aware of, but the exact role of social workers is often not well understood. Typically, social workers will hold a master's degree in social work, although we tend to think of, again, because of movies and TV shows, we tend to think of social workers as being people that are typically concerned with social welfare, public assistance programs. In reality, there are social workers who work in the mental health, behavioral health space. These individuals often are the first point of contact for individuals that have mental health challenges. They can, with appropriate training and experience, social workers can provide counseling, case management, which entails coordinating in a holistic way the different kinds of services an individual receives, given whatever their condition or challenges. In this way, they can help connect individuals with other healthcare resources. However, there are also varieties of social workers, such as licensed clinical social workers, that can provide counseling services independently. Another variety of social worker, licensed master social workers, can also provide counseling, although typically they will do so under the supervision of another social worker who has more advanced licensing or other credentials. Licensed professional counselors, LPCs, are individuals who typically hold a master's degree in counseling psychology, not clinical psychology, counseling psychology or related fields. Oftentimes, this pathway for counseling psychology goes through a master's in education rather than a master's in psychology. These individuals are trained to provide counseling as a primary method of treatment. There are, if we look at the dictionary, some distinctions we would make between counseling and therapy. I'm not going to get into that distinction here, but suffice to say that LPCs are a major part of the workforce in mental health, behavioral health. They can be found in different settings, especially and including hospitals, clinics, and schools. Board certified behavior analysts, BCBAs, will typically hold a master's degree in behavior analysis, psychology, education, or a related field. These professionals specialize in therapy for individuals who struggle with emotional regulation. These may be individuals who have a behavioral condition, perhaps sometimes a cognitive disability, or other similar condition. Oftentimes, BCBAs work in particular with children. Their main day-to-day task or role is to help train families and educators on how to address challenging behaviors from these children, as well as working with children directly to assess the roots of their behavioral challenges and try and help develop routines and programs that can help the children or their other patients or clients be able to manage their behavioral issues in such a way that they can function more readily and hopefully diminish the severity of the challenges they face being able to function day to day. School psychologists typically hold a master's degree in psychology or education or related field. Their role is to provide diagnoses and, in some cases, therapy and other kinds of support to school staff as well as students. Uh, Typically, school psychologists spend a lot of time promoting wellness within educational settings. Many of us, probably from our lives growing up, have encountered school psychologists. Uh, so this is a pathway that many students don't necessarily think about, even if they have been exposed to it in the past. Finally, just to kind of wrap this up in sort of a catch-all way, there are different kinds of mental health professionals whose title will be some variety of therapist, marriage therapist, family therapist, child or adolescent therapist. This covers a lot of ground, and the specific kind of day-to-day work, the specific pathway for these different kinds of therapists will vary. At the high level that I want to keep this video to, I'll just mention that in almost every case, any kind of therapist or someone who has a therapist title will hold at least a master's degree in psychology, counseling psychology, or related field, with specialized coursework in, for example, marriage and family therapy, addiction counseling, other areas of mental health. Therapists are trained to provide individual and group counseling, working, for example, with couples who have troubles in their relationship, families who may have issues within the family, for example, parents having conflicts with children or vice versa. And often their main goal is to identify and address negative behavioral patterns, help individuals gain some insight into their motivations, the roots of their behaviors, and as necessary, as desired, try to modify those behaviors. Again, this video is only scratching the surface of many pathways in mental and behavioral health, but hopefully now you have a better idea of different routes you can take if you are a psychology major or majoring in a related area, and you'd like to end up in a career where you are providing therapeutic or counseling services to patients and clients. I hope you found this video helpful. If so, I would greatly appreciate you leaving a thumbs up, like on the YouTube video. Also, if you consider subscribing to my YouTube channel, that would really help the channel grow. Thank you very much for your attention, and the best of luck.